Hello, today we will go over the basics of providing first aid in case of absence of breath and consciousness, specifically CPR. CPR is a set of measures aimed at restoring vital functions in a person. According to the universal algorithm of first aid, once you have ensured your own safety and the safety of the patient, we proceed to assess the patient's consciousness. You need to ask the patient simple questions or shake them. After that, if the patient does not respond, it is necessary to open the airways. To do so, open the airways, place one hand on the forehead of the patient, use two fingers from the other hand to hold the chin, tilt the head back, lift the chin and lower jaw. Lean towards the mouth with your ear. You will hear and feel normal breathing, and at the same time, observe movement of the chest. Check breathing for 10 seconds. In the absence of consciousness and breathing, call emergency services at 112 or 103 if it is possible to ask someone else to make the emergency call. If no one is available, start CPR or put the call on speaker. Cardiopulmonary resuscitation, CPR, starts with indirect cardiac massage by placing the palm base on the midpoint of the chest, without showing how to find the midpoint. Begin by positioning one hand, then place the second hand on top, interlocking the fingers with the upper hand's fingers straightened and the lower hand's fingers pulled back. Leaning over the victim, conduct compressions at a rate of 100 to 120 per minute, with a depth of 5 to 6 centimeters or 1/3 of the chest. Perform 30 compressions audibly. After completing 30 compressions, administer 2 artificial breaths. The head is tilted back, a barrier device is placed on the face, and the hand on the forehead presses the nose to the bridge and firmly covers the patient's lips with one's own lips. Perform a normal exhale while keeping an eye on the rise of the chest. Once it rises, that is sufficient. After that, step back from the patient, allow for exhalation, and proceed with the second inhalation. Note, if the chest does not rise or if we did not see it rise, we do not perform additional inhalations and proceed to CPR. No more than 10 seconds should be spent on the 2 artificial breaths. We alternate between 30 compressions and 2 breaths until we reach the following moments when we can stop performing resuscitation measures. 1. Appearance of life signs. 2. Arrival of emergency medical services. 3. Insufficient strength to continue resuscitation.